Mesothelioma is an aggressive form of cancer that develops from the mesothelium, the protective lining that surrounds many of the internal organs of the body. The mesothelium lining the lungs, heart, and abdominal cavity are primary sites where mesothelioma arises. As the cancer progresses, it can metastasize throughout the body and become very difficult to treat. Unfortunately, mesothelioma typically has a very poor prognosis. However, advances in targeted therapies and personalized treatment approaches are helping to improve patient outcomes. Biomarkers play an important role by helping physicians determine the best treatment options for each individual patient. Some of the most promising biomarkers currently being studied for mesothelioma include mutations in the BAP1 gene. Loss-of-function mutations in the BAP1 tumor suppressor gene are found in around 50% of all mesothelioma cases. BAP1 mutations lead to dysregulation of cellular processes involved in DNA damage response and repair. Testing for BAP1 mutations helps identify patients that may benefit from targeted therapies designed to exploit vulnerabilities caused by loss of BAP1 function. For example, PARP inhibitors are being investigated as a potential treatment approach for BAP1-mutated mesothelioma. Ongoing clinical trials are evaluating PARP inhibitors such as rucaparib and niraparib for mesothelioma patients with germline or somatic BAP1 mutations. Mutations in the NF2 gene. Loss of the NF2 tumor suppressor gene, which encodes the protein Merlin, is the hallmark genetic alteration in the epithelioid subtype of mesothelioma. Around 40 to 50% of epithelioid mesothelioma tumors have NF2 gene mutations or deletions. Testing mesothelioma tumors for NF2 mutations helps determine whether treatment with novel agents targeting the Hippo-YAP signaling pathway may provide clinical benefit. Drugs that inhibit YAP signaling, such as verteporfin, are showing promise in preclinical studies of NF2-mutated mesothelioma and are currently being evaluated in early-phase clinical trials. PD-L1 expression, programmed death ligand 1, PD-L1, is a protein that binds to PD-1 receptors on T cells, suppressing anti-tumor immune responses. Many mesothelioma tumors upregulate PD-L1 expression as an immune evasion tactic. Testing tumor samples for PD-L1 levels helps identify patients that may respond to immunotherapy with PD-1/PD-L1 checkpoint inhibitors such as nivolumab, pembrolizumab, and tislelizumab. In clinical trials, about 10 to 20% of mesothelioma patients achieved objective responses when treated with PD-1/PD-L1 inhibitors as a single agent. Ongoing research is evaluating biomarkers like PD-L1 that could help select patients most likely to respond to immunotherapy. Mesothelin expression. Mesothelin is highly expressed by malignant mesothelial cells in mesothelioma tumors but is barely detectable in normal pleura. Testing for mesothelin expression can help predict response to targeted therapies like anti-mesothelin immunotoxins and antibody-drug conjugates. For example, the anti-mesothelin antibody-drug conjugate DS-8201A showed impressive responses in mesothelioma patients with high mesothelin expression levels. Ongoing trials are elucidating the correlation between mesothelin expression and clinical outcomes with this targeted therapy approach. Monitoring changes in mesothelin levels during treatment may also help determine if a patient is responding or becoming resistant. MYC1/GDF15 levels, macrophage inhibitory cytokine 1, MYC1, and growth differentiation factor 15, GDF15, are secreted proteins involved in regulating cancer growth, apoptosis, and metastasis. Elevated serum levels of MYC1 and GDF15 have been linked to worse outcomes in various cancers. In mesothelioma, high pre-treatment levels of either MYC1 or GDF15 in patient blood samples independently predict poor prognosis. MYC1/GDF15 levels may help identify high-risk patients that could benefit most from aggressive therapies or enrollment in clinical trials of novel agents. Lowering MYC1/GDF15 levels through treatment could potentially serve as a surrogate marker for monitoring therapeutic response. Circulating tumor DNA. DNA refers to fragments of tumor DNA that circulate freely in the bloodstream. Next-generation sequencing technologies allow highly sensitive detection and genotyping of DNA shed by mesothelioma tumors into patient blood. Monitoring changes in DNA levels during treatment can provide a non-invasive method for early detection of response or relapse. Specific DNA mutations may also help guide subsequent therapeutic choices. Several studies have demonstrated that higher pretreatment load corresponds to shorter progression-free and overall survival in mesothelioma patients. DNA analysis holds promise as a minimally invasive liquid biopsy tool for tracking disease burden, detecting resistance mutations, and personalizing treatment decisions in mesothelioma. As research continues apace into the molecular underpinnings of mesothelioma, new candidate biomarkers will undoubtedly emerge that can more precisely predict outcomes and guide management decisions. By correlating biomarker expression profiles in large numbers of patients with detailed clinical information and treatment responses, scientists aim to develop highly optimized algorithms for selecting optimal targeted therapies or immunotherapy combinations for individual patients based on their unique molecular tumor profile. This precision medicine approach holds great promise for improving clinical outcomes over conventional one-size-fits-all chemotherapy regimens in the treatment of this aggressive cancer. Proper validation and qualification of reliable mesothelioma biomarkers will be crucial for enabling their clinical implementation to deliver personalized care and extend survival for mesothelioma patients.